Hi, Dr. Sophie. Welcome to our Fireside Chat. I'm Sarah Chusid, a Physical Activity Program Manager at the Illinois Public Health Institute. Could you tell us a little bit more about who you are and your role in PE?
Absolutely, Sarah. I am Dr. Jean Sophie, the recently retired in June of last year, Superintendent of Lake Bluff Schools, where I served for 8 years. As a school leader, I was always thinking about how to support our students' academic learning and well-being. Well, in 2012, I was asked to serve as the Illinois Association of School Administrators representative on the Illinois Enhanced Physical Education Task Force, a state task force charged with coming up with a plan to promote enhanced PE in Illinois. I came to the task force ready to say no to all proposals because there are so many other things leaders need to be careful of and where monies need to go, etc. But over time, I became convinced by the research that was presented during these task force meetings, showing the return on investment that enhanced PE brings for students and for school districts. Through this experience, I became a huge PE believer and champion in the value of physical education for all students. I'm so glad to be here to pass along some of my experiences and thoughts on how school leaders can champion PE in their school districts.
Thanks for that background. So you'd mentioned that research was important to your journey in becoming a PE champion. Can you tell us more about that?
Absolutely. During the task force meetings, a lot of neuroscience research that links physical activity and fitness to improve learning was shared. This was the first slide I really started looking at. It rang true to me. I thought about my past school districts and how many students had struggled to get to school and struggled in school. There is a growing body of neuroscience research that shows a return on investment for implementing enhanced PE programs, with improvements seen in test scores, academic achievement, and in class behavior. As you can see on the slide, improved fitness and physical activity levels are associated with improved health, a reduced risk of disease, improved mental health, and fewer sick days from school. Physical activity makes better learners through improved academic and cognitive performance. Physical activity is associated with improved behaviors, more on task, and less disruptive behaviors in class. This research is really showing improvements. This is the slide that really made me a major advocate for physical education and physical activity. These images demonstrate the impact of movement on brain function. This is a composite of the scans of 20 middle school students' brains while taking the same test. The brain image on the left is a composite image of students who sat quietly before taking the test. The brain image on the right is the same 20 students taking the test after a 20-minute walk. You see that the brain on the right is much more lit up, indicating that the student is ready to learn. In fact, students who have regular daily PE directly before the courses where they're struggling most academically, math or literacy, for example, have shown to demonstrate growth a full grade level higher than their peers. Studies show that students who are more fit score better on standardized tests as well. So I worked in a small district. We had about 900 students, and we already had daily PE and wellness scheduled. There was a lot of talk at the state level of eliminating PE. But I brought in this research. I met with our wellness teachers, our administrators, and our board, and brought this research to them. As a result, we started emphasizing brain breaks, and we kept daily PE. We had the wellness teachers start every day with brain breaks. They in turn taught other teachers brain breaks they could use in their classrooms. Test scores were on the rise after doing that.
That's really great and compelling. I believe more recently, you've also started talking about the connections to social emotional health, correct?
As you know, there are increased issues with social emotional health in schools, and in physical education can help with that too. According to a report from the National Academies of Sciences, Engineering, and Medicine, physical activity in youth can improve mental health by decreasing and preventing conditions such as anxiety and depression, and enhancing self-esteem and physical self-concept. You can see the benefits listed on the slide. Improved mental health, decreased anxiety and depression, better self-esteem, and kids feel better when they move. We also know that PE class can help teach cooperation and other skills needed for strong social connections. It was at this point where I started thinking maybe we can't afford not to involve kids in physical activity. The improvements are really something to think about.
Thank you. That's a great story. Are there challenges you have faced and tips that you'd like to share with others?
You know, one of my biggest challenge areas, Sarah, has been how can we help school leaders support wellness? As a superintendent, I can say it's really hard to get in front of a superintendent group and superintendents in general and talk about PE and physical activity. They have limited resources and so many wants and needs. But there are ways school leaders can support wellness. They can learn about the link between physical education and improved student outcomes, prioritize school health and physical education, educate their school board on the importance of PE and wellness and the return on investment for learning and behavior, encourage regular enhanced PE and the recommended amount of physical activity for all students, provide professional development for physical education and health staff. So that's my story. I believe strongly in physical activity and physical education for students.
Thank you for sharing, Dr. Sophie.